To combat with the lack of in-person mission trips, has telehealth been successfully utilized overseas?
So that's a great question. That is a great question. Um, I want to first give a blanket answer, and that answer is yes, of course. But I want to go into that a little more deeply because, so I don't know how familiar you are all with telehealth. I also serve as the as medical technologist for Tera Health, and our primary focus has always been on telehealth services.
Mm-hmm.
Also for Global Human Services in 2008 when we were formed,
Mm-hmm.
the idea was to deploy a modular hospital system that could be set up anywhere in the world in a matter of hours, as opposed to setting up a clinic over a period of days and or weeks. But what made these units really unique was that we designed into them very sophisticated lab systems, immunoassay systems. We also designed into um, the modular hospital unit satellite-based telehealth in 2008, with the idea being that everywhere a unit is placed, data from its location would be reported to a satellite, and that data could be seen and read by academic health centers around the world. The idea behind that was to have global participation in healthcare delivery in very poor countries. So I say all that to give you some background. The reality here is that what we would hope is that universities around the world, the medical centers around the world, are communicating with one another in a discussion that is dealing with COVID-19 and dealing with the rate of infection and dealing with how information is being disseminated on a global scale. Because one of the big challenges has always been, how do we get information to people who are in rural communities?
Yeah. Mm-hmm.
And it's really hard to do. It's already hard enough, but with the fear of being infected with COVID-19, it's even harder.
Yeah.
Much harder.
Mm-hmm.
And, as we all know, one of the big challenges has been that information continues to change. And so it's difficult to know what to follow. Even information that's coming from credible organizations, the World Health Organization, the National Institutes of Health, the data is changing because the science is changing. And the science is changing because the research is changing. And thus there are ongoing discoveries related to COVID-19 infection and related to its long-term effects. And there were even for a long period of time changing information on the route of transmission and how to best protect ourselves with respect to public health policy. So there have been a lot of challenges, and we probably have all even heard about a number of cures over the counter. We were hearing here in the United States even about the use of bleach
Oh, yeah.
in, right. So there's been a lot of misinformation. There's been misguided and misunderstood science, and there have been a lot of politics. And those have all combined to create challenges, particularly for people who are poor and are wanting to get on with their lives, but now don't have the ability to get out and work in industrialized countries or to trade in developing countries. And if they're unable to trade for food, then they can't feed their families.
Yeah. Thank you for answering that. That was a very complex topic, but the way you addressed it and answered it was great. Thank you. Has the lack of internet access impacted telehealth?
That's also an interesting question. So the lack of internet access has always been one of the challenges of telehealth and telemedicine. And just to draw a distinction, telemedicine is dealing more with physicians talking with other physicians about particular types of cases versus, and education also, versus telehealth, which is dealing more with healthcare providers connecting with patients wherever they may be. So the lack of internet connections in rural parts of the world, not just, there are rural parts of the United States where there's also a lack of internet connectivity. These have always been problems. One of the ways that that we in telehealth, practitioners of telehealth and telemedicine, have been addressing that particular problem is to look at community-based health centers where people from the community would come and be able to access an internet connection. So if you have a village, let's say in rural Ghana, where out in the cocoa farms and cocoa fields, there would be a community-based health clinic where people would be able to go. There might be 500 people living in the village, one clinic that's serving higher population, and usually a community health worker who travels out from the community center and goes in to talk with people who are living in the village. But with COVID-19, I think that every reasonable health policy would be that we can't travel out to where people are living. If there is that coverage, if there are that many people who need to be seen, there would have to be other approaches that are used. There are ways, satellite-based systems, for example, are used by military, right? By the US Navy, US Army. We can use those types of systems, satellite-based systems that are very portable. We can use those systems in deploying community-based health. The challenge is that they're not inexpensive. They are expensive. They require some training. And so the direct answer to your question is absolutely a lack of internet access is a problem. There are many approaches that that are being developed to address that problem, but another item really at issue is that we then have to train people how to use it. And we don't necessarily have the time, we don't necessarily have that amount of time where the infection rate is growing the fastest.
Yeah, that makes sense because the virus is slowing down for anyone.
Right. So I think that, just to add this one piece, we needed to be better prepared as a global community.
Yeah.
We needed to be better prepared, and we should have been able to take a lesson. We should have learned a lesson from past epidemics and pandemics. And I want to just point to something, if I may, real quickly here. So at the time that we formed Global Human Services, it was HIV/AIDS.
Okay.
That was the global infectious disease epidemic and pandemic. And so I pulled some statistics this is a report from the United Nations in 2008 that is indicating globally there were an estimated 33 million to 36 million people living with HIV in 2007. The annual number of new HIV infections declined. Now, this is interesting. Declined from 3 million, 2.6 to 3.5 million in 2001 to 2.7 million new infections in 2007. We should have learned, I think, a more substantial lesson from from HIV. There is more information that we should have known. We shared. And, you know, there is a consensus, and I am in agreement that there has simply been a lack of leadership in responding to the coronavirus pandemic, COVID-19.
Yeah. Thank you for those statistics. Thank you.